On? On, yeah. So, a very good afternoon all. So, we have all joined here for discussing with respect to the screen time and the effects upon our kids. So, if we, before that, myself, I'm Dr. Santosh Kalyan. I'm a consultant pediatrician and a pediatric intensivist. My active area of interest is pediatric intensive care. So, in this field of pediatric intensive care, we have been doing quite good job at our Lotus hospitals, Visakhapatnam. At the same time, we do have a state-of-art facilities here. So, rather than discussing something unrelated, let us have a fruitful discussion on today's topic regarding the impact of screen time in children. So, coming to the screen time actually, so what does the WHO guidelines say with respect to the screen time? So, according to the WHO guidelines, the recommended screen time for children less than 2 years is almost 0. And between 2 to 5 years, the recommended screen time is hardly half an hour, but that too under supervision. And later on, after 5 years, it is only barely we can allow for till 1 to 2 hours, but that too under supervision. So, firstly, would this screen time really affect our kids? Yes. We see a lot of virtual autism of late. So, what is this virtual autism? And before that, what is this autism? So, autism is a condition where, in very simple terms, it is actually a spectrum of disease where usually the kid interacts less. The kid doesn't interact with the peer group children. The kids are in their own world, I would say. So most of the times, and there would be a component of speech delay, and at times, usually, sometimes parents come to us. They're saying like, they would say, "Sir, my kid has been like off late, very moody, or my kid doesn't really interact with anyone. My kid is not playing with the peers. So my kid is not joining, is not performing well in the school. The school teachers have been saying like, my child is not interacting with other kids. So my kid is not performing well." So when we really look into this, so what might be the cause? Then when we ask the parents, is your child habituated to look at the screens? The off late, very surprisingly, especially post-COVID, the answer for this question is becoming yes, 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 yes. So we really, at times, so in fact, even prior to 2020, or in fact prior to the COVID time, we had hardly seen this autism centers. We had, there were very few autism centers. There were very few learning disability centers. But now, this autism, ADHD, any developmental disorders per se, have become so common, and now the speech delays have become so common that parents are like really worried with respect to that. So, what happens when the child looks at the screen? There will be like all these screens. They have like lot of processing happens in the brain. The images are very bright. The images, they move very fast. So that fast moving images, that bright images, they do have an impact on the brain of the small child, and especially a growing brain. For example, usually the brain growth gets completed by 2 to 4 years in maximum. So the impact will be very, very high. So in all the cases, it's always better to avoid screen. It would definitely decrease the incidence of virtualism. At the same time, it will definitely decrease the chances of your speech delay. Again, it's rather than science, we speak, let us speak, keep things in a very simple way. You keep on doing one thing, you get habituated for that. You stop doing that, you'll not be able to do. In the same way, it is like you give a phone screen to your kid completely looks at the phone screen and barely interacts with you or like interacts with the other kids. So what happens to because of this? So once this happens, usually the kid automatically gets engaged in some other thing. So once he gets engaged, why would he talk? So there is no big science in this. So he would just spend time looking over the phone. So it is like, in order to make him habituated, just ensure that the kid doesn't have the phone. Ensure that, or in fact, any type of screens, and doesn't mean that phone screen alone. And the other very common thing what we really encounter of late is, sir, we very much see this in the OPDs. Sir, మా పిల్లాడికి అదేంటి ఫోన్ చూస్తే కానీ ఏమీ తినట్లేదు అంటే, have we really trained in that way that only after seeing the mobile that you started to eat the food? No, we are not trained. It's never like that. Only that phone will make you eat. It is how you tune your kid. Maybe there will be some resistance initially for 15-20 days, maybe a week or two, but you stop conditioning that in the form of giving the screen. So obviously, maybe that initial resistance will go away. And once that initial resistance goes away, the child automatically will start eating the food without any conditioning. It's very simple. It is like how you condition your child, how you condition his brain, things are going to work in that way. You don't you teach him for the phone, you give him he get let us make eating a healthy habit rather than making it a form of mechanical eating. Just like you keep the screen, because we make the eating mechanical, the child doesn't know what he's eating. He doesn't know the quality that is going in, like regarding the nutrition. And in fact, he would not learn anything. He wouldn't chew the food properly. There will be like lot of digestive issues. So let us not make the eating habit mechanical. And yes, be prepared that kids will take really long to eat, and we should be ready to accept that. If a kid really eats very soon, why would they become kids? So they are kids. We need to accept the fact. We need to go through that phase. Yes, it takes a lot of time for them to eat, but giving phone or like showing them the screen is not the answer to make them eat. Hope my small session on this will definitely help most of the young parents or the new parents who are or rather than I would say the anticipating parents. So let us ensure, let us all pledge, we will make a screen free, we will bring up a screen free child. Hope many of you are accepting with me, and hope everyone would start at this thing at their respective homes. And in fact, use the time for actually interacting with your child. Use that time for asking what are the things that is going on. That would really help him. Yeah, thank you. Thank you, Dr. Akila Garu. Over to you, Andy. Any questions from anyone? It would be really nice if somebody interacts. Yeah, oh, good. My 3-year-old son spends 3 to 4 hours a day on a mobile phone and started speaking very few words. Could screen time affect his speech development? Yes, this is what we have discussed already. Definitely, the screen time would affect the child's speaking capabilities, the way the child will talk, the way the child will interact. It's just you're not giving him the chance to speak because your phone will, watching the mobile will make him get engaged into that screen. Hence, complex neuronal processing will happen, and hence there will be a delay in his speech. So definitely yes. So ensure that decrease the screen time of your kid, and it would really help. Yeah. Any more questions, Andy? Sir, I think one more question popped up. So my daughter refuses to eat unless she's watching videos on phone. Is this a concern, and how can I change habit? Yes, I wouldn't say this is a major concern, but I don't think this is a right way to do the things. I think things shouldn't. Again, as I was saying, as we had discussed, eating would have become mechanical. So, in order to stop that mechanical, making the kid eat while watching the video is just a mechanical form of eating. So, which is not a good habit at all. The kid wouldn't really chew the food. The kid would just directly swallow. So that there would be a choking hazard. There would be some digestive issues. So definitely making your kid eat, showing a video is not a great this thing. So how can you change this habit? Yes, give more time to your kid. Spend time with your kid. Get prepared that eating takes longer time. At least I would say, with respect to my kid, at least the eating session goes for 1 to 1.5 hours, and that is how kids are. We need to accept that. We just shouldn't try for any shortcuts. Doctor, I think one more question has come. Doctor, my toddler is constantly using a tablet, but avoids using a tablet, but avoids eye contact and social interactions. When should parents seek medical advice? Yes, if a toddler is avoiding eye contact and there is no social interaction, there's a high risk for this child. I wouldn't say definitely this child, but I would say there's a high risk that this child can land in the spectrum of developmental disorder, either autism or ADHD, or sometimes a combination of both. So definitely, I think you should really seek a nearby pediatrician, or if you have a developmental pediatrician available at your place, a developmental pediatrician, or if not a developmental pediatrician, at least a general pediatrician would definitely help you with this condition. So do definitely visit the doctor who is available nearby. My child wakes up several times at night after using screens in the evening. What can we do to improve the sleep quality? Very, very simple. But see that rather than saying simple, yes, your sleep quality gets affected because of the continuous screen utilization. So the best way is to avoid screen, especially even if you can think, even we utilize the screen just before we sleep, we definitely have that bad sleep. So at least ensure that your child doesn't use the phone by just before sleeping. At the same time, ensure that you yourself doesn't use the phone, or you yourself ensure that you are not doing all that stuff of seeing the screen. So once you do, things will actually get simulated, because your child simulates, you remember that. So you stop the screen, yes, maybe eventually over a period of time, your child's sleep quality will definitely improve. My 10 years, yeah, one more question. I think good. I think people are interacting quite well. My 10-year-old complains of headaches and eye strain after online classes and gaming. Could screen time be the reason? Yes, definitely headache and eye strain, because your eye muscles, they constantly work. There are something called as oblique muscles and rectal muscles around the eye. So, in order to continuously adjust or continuously get focused, your eye muscles strain up. Maybe this is the reason actually. If you remember in this offline classes, after every 2 periods or 3 periods, they give a break. So one thing is, it would directly avoid give your brain some relaxation. At the same time, it would decrease the strain on your eyes. So online classes and especially gaming, because of that high moment, high processing of this thing, it can really affect your child. So yes, headaches and eye strains can very well happen. In fact, it's not just for kids. Even it can happen for us. You see the screen for a longer time, you definitely are going to get that headache or eye strain. So it's always better to avoid that. Yeah, my child is unable to manage daily activities like dressing, eating, or toileting independently. Is this common in intellectual disability? She's 4 years old. 4 years old child dressing, eating, toileting independently. Some kids might do, some might not be able to do. So I wouldn't really call this child an intellectually disabled child. Maybe I would still take some more time. I would ensure that this kid is given adequate attention, adequate training, adequate love, maybe parental attention. I think things can change definitely. But at the same time, just to be on a safer side, I will definitely take one medical advice also. Yeah, the one more question has come up. My child is 2 years of old. How many hours of sleep does he? See, there is no hard and fast rule like 6 hours, 8 hours, 10 hours, 12 hours. But ideally, maybe 10 to 12 hours per day is a good sleeping time. So, good sleep gives good immunity. So, once the child sleeps well adequately, the immunity will improve, and once the immunity improves, probably less infections, less hospital visits, less burden to the pocket also. Yeah, one more question I think. Sir, my kid often mimics aggressive behavior seen in online videos and games. Open. See, definitely, as we have discussed previously, it is just that we simulate the things. So, what we see will definitely have an impact upon our brain. So, probably if he has been watching some aggressive games or like this fighting games or like this road car games where the cars go with high speed. So maybe these are times actually the kids playing get trained. So trained or like, or I would say get tuned. So maybe because of that, that aggressive behavior. So how parents should handle this? Simple, keep try avoiding all that. Your kid obviously will improve over a period of time. So just try to avoid that online video games, especially for long usage. My child, yeah, one more interesting question from my parent. My child cries continuously when I take away the phone. How can I reduce his screen dependency? Yes, the moment you take over the phone because the child got habituated, the child might initially get anxious, the child might initially get suppressed, the child might get initially very angry. So, yeah, you just need to, I know it is not very easily possible to explain the child always. So the best way is like be more attentive to the child, give more attention to the child, uh, and maybe try to deviate the child rather than keeping them in the home. Just take an outdoor. Uh, Try to be more interactive. So maybe that crying episodes would be there for 3 to 4 days, but probably in the next 7 to 10 days, if you can really habituate that, if you can really bear that, that habit will definitely come. Yeah. I think one more question. As working parents, we rely on screens to keep our child occupied. What are the healthier alternatives that are practical to implement? The healthier alternatives are very simple. Whenever, if you have a peer group in your society, make them interact with the peer group. There are like non-screen activities. You can do that. You can make your child spend his energy. For example, with lot of facilities available, we can take our child for swimming. We can take our child for some form of outdoor activities or indoor activities like chess, for example. If it is very sunny with this bad summers, chess, carrom board, or some form of activities. You can bring in, pitch in the grandparents. The grandparents can actually uh, share their stories. You can very well get a well-trained babysitter who will actually interact with the child. Just ensure that babysitter doesn't get any other work other than the domestic work, so that the babysitter concentrates on your kid. At the same time, whenever it is possible, do take a break. Yeah, work is definitely important, but our kids are equally or more than I feel. Yeah, my child has developed pinching others and self may pinching more. May know what's the reason. See, probably this is because the child, I think from Tejasvi Garu, may know what's the reason. See, that pinching is probably because the child might have seen the behavior, uh, either because usually children learn from us. So probably, or else if your kid has been going to school, probably she had seen that somewhere. So do identify the root cause where she has seen. So sit with her, spend time with her, explain her that this has to be done. Maybe she would definitely stop that. So, and at the same time, ensure that we never do that at our place. That's all. Any more questions? If no more questions, I think we will take a break. Yes. I think one more question has come up. Even after stopping sweets and all, after going to all the therapies, also a lot of sensory issues and hyperactivity. Yes, see, think, therapy for this is not like your paracetamol tablet where you take for a day or like you take for a week or 10 days, things will just improve. So it is just going to take some time. At times, the time can extend till around 6 months, 1 year. At times, we had seen children taking up to 2 years for to attain a complete improvement. And it's not just that the therapy sessions would alone help. Along with the therapy sessions, you need to have a lot of interaction from your side, lot of efforts from our side. Yeah, I know it's quite lots of patience and lots of constant motivation. So with this, your child will definitely improve. Let us all hope for the best. Don't lose any hope. Things will definitely go well. Yeah, I think, hello sir, my daughter is diagnosed with ADHD. She has sleeping issues. We were advised melatonin, how safe it is and how long can I use? We are using for 3 months now, but not regularly. See, probably as such, melatonin hasn't been the drug which has been completely approved for ADHD. See, these are but if your child has been prescribed melatonin by a qualified practitioner who is qualified, probably he might have had something in his mind. So you can use melatonin as such is, I wouldn't say it's a very toxic medication or yeah, you can use melatonin, but since you have used for 3 months already, uh, but can I ask a follow-up question if you don't mind? But not regularly in the sense like for how long have you been using this melatonin? Like were you giving it daily or like once in a week, like twice in a week? May I know a bit more clearer on this aspect, Siddhi Garu? Yeah, 3 months for now. I give for 3 or 4 days in a week, right? In a week, 3 or 4 days in a week. was prescribed by a neurosurgeon. May but may I know why a neurosurgeon was consulted in this first hand? Maybe a neurologist would have been ideally a developmental pediatrician, or a pediatric neurologist would really help you to take a call. I don't think I should, maybe I am not putting like the right words, but any reason specifically for opting neurosurgeon? Any reason for opting neurosurgeon? She had seizures a few months back. Was the child evaluated for the seizures only? And any trauma was the reason for seizure? Okay. Yeah. So, sir, but madam, I would really suggest you to consult a pediatric neurologist, not a neurosurgeon, pediatric neurologist. Take the advice of pediatric neurologist and then go accordingly. Maybe that would really help you. We have a lot of good pediatric neurosurgeons available now. Pediatric neurologists available now. So my advice, just go visit a pediatric neurologist, say them this complete history. Maybe they would definitely help you out. Any more queries? Any more questions? Kilagaru, any more questions in me? Yeah. Thank you all for joining this session. I really had a great experience interacting with you all. Have a good day.